nothing can prepare us for the current extent that we are facing now. Starting early this year, we've been seeing really, really sick people. And we are not talking about elderly people. We are talking about people who are young, people who don't have any medical illness, getting severe COVID Cat 4 and Cat 5.
We are losing lives, we are losing people's mothers, fathers, children. And to know that this has come, to our country.
I'm just thinking of when is this going to end?
So I had to come on behalf of my colleagues because it's just heartbreaking.
I've been fighting COVID since last year in the front lines. The numbers are not fake. The numbers are actually underreported. I can tell you that based on the positivity rates, 1 in 10 people that you know among your family members, among your friends are already having COVID.
Actually, even the death rate of COVID yang we announced in the mass media is not exactly reflective of death rate that we are seeing.
The deaths are much more higher. KKN doesn't report if the patient dies something else with COVID, or patient has already passed the 14 days and then they suffer from, let's say, blood clot in the lungs, blood clot in the legs, or heart attack or stroke.
Why we are getting more deaths? Because we have not enough resources to support all of the patients.
And you can see patients piling up outside EDs, patients holding out extension beds in wards, patients who are 1 tile away from each other. You think that we could hold the fort and keep going?
People kept saying that if the patient needs more ICU bed, why can't we create more ICU beds? Because ICU beds are not just buka satu katil and put the patient there. It's a team. And right now, we have people who are selalunya tak train untuk jaga patient ICU, kena jaga patient ICU. And we are creating ICU beds dekat tempat yang bukannya ICU. Macam operating theatre, oncology wards, kena kita ventilate patient dekat dalam ward. We're not supposed to do that actually. I'm aware of plans nak convert clinics. Our clinics yang the one yang kita tengok outpatient review untuk letak patient yang need oxygen bed. So basically kita convert our consultation room untuk jadi bilik patient juga. Even the private sectors also are currently quite full to the brim. We are looking at the possibility that all of the hospitals in Klang Valley will be full capacity.
I can only say, if you think the ship is still sailing, I think it has sunk. If you think houses are not yet burning, it's already burning.
We need more equipments, we need more oxygen tanks. For the past few weeks, we are dealing with shortages of major medications that we use to treat COVID. We're not receiving help from the HQ and we are basically dying in this battle.
It's like a ship that's sinking, like people are really trying to keep the ship afloat, but there's people putting holes right in the bottom of the ship.
You want to imagine what's happening in Malaysia? We are already in Italy 2020. We are already in India 2021.
Since April, we've exceeded our 100% bed capacity multiple times.
Doctors have been forced since 3-4 months ago to choose.
We have to choose those who are elderly, as they are more high risk to deteriorate further. We prioritize them for beds, and the others unfortunately have to settle for plastic chairs.
The wards are all full and clogged. Sampai ventilator pun tak cukup.
Every day when you come to work, we have a great number of people who desaturate, meaning suddenly unable to maintain normal oxygen levels.
We are replacing oxygen canisters by the hour. Some patients might require to share oxygen with other 5 patients.
Pressure tu, bila you have a lot of patients using the oxygen, We cannot generate enough flow. There are some patients who may deserve to be intubated, but we cannot intubate because we have breached our capacity.
We have times where oxygens are not available. I have my nurses having to not only carry out nursing job, but they have to liaise with the members of transports, go and get the oxygen replaced every 2 hours because there's only so much one canister of oxygen can do.
We cannot wait untuk kita orang submit proposal untuk present dekat meeting budget untuk get more oxygen tanks. We need it now. When we end up fundraising on our own, we get told off. It's really, demotivating to us.
It's a bit overwhelming to say all this. I'm working in a center of quarantine with a limited number of staff. It gets to the point where everyone is demotivated, everyone is burned out.
Currently at my place, 9 animals have active COVID-19 infection. There's also, I think, about 20 plus nurses and medical assistants who also have COVID-19 infection.
Every other week, you get house officers, medical officers being quarantined, and when one person becomes positive, suddenly the whole group becomes positive.
When they are unable to attend work, the rest are forced to cover their job scope because there's nobody to replace them.
Everyone would be overworked. Then we face a severe shortage of staff.
We don't have enough specialists, consultants, MO, HO, you name it. When are we getting enough manpower to support us? When is the new people coming? This year alone, my hospital has not taken enough housemen to cover the situation. It is really stressful.
Orang-orang lain pun nak tolong sana sini, kena tarik sana, kena tarik sini.
I'm a houseman, but they just put me to cover like 4 to 5 wards in the night call. It is in different levels, and I just have to juggle here and there, and I just hope that I don't kill anyone. I didn't kill anyone that night. My staff nurse keep calling me. I just cannot attend the patient.
As much as we want to keep going, it's just it's so tiring.
Kita tengok ICU dah overwhelmed,
and a lot of these patients don't respond very well to the current treatment, which is our steroids, our tocilizumab, and they deteriorate with multi-organ failures from get-go. And on top of that, even if they responded, they stay very, very long in ICU. Let's face it, last time we have more elderlies. If they get very severe COVID, they have poor reserve, they won't make it after a few days. But right now in our ICUs are actually young, fit patients. Diorang kind of respond, but they really take a very, very long time to recover. So that's why our ICU is clogged up. Kita orang tak boleh keluarkan these cases. Some of them dah berbulan dekat dalam hospital.
Well, if you think COVID just affect the COVID patients, I'm telling you it's not. I'm working in a pediatric department. I'm taking care of patients like needing liver transplant. They need ICU backup. But because of this situation, they might need to postpone their surgery. This 1-year-old or like 6-month-old babies. I don't know how to answer the parents. When is their child getting all these necessary procedures for them to carry on with life? So yeah, we are telling them like we are really trying our best to get the ICU backup for you, but we have an outbreak in the PICU. We couldn't like proceed with all these high-risk procedures and surgeries. Recently, we have an outbreak in the oncology ward. It's really sad that the whole ward have to close down, and then all the parents, all the patients are going for swab and tested positive and infected the staff as well. But can you imagine in one night time, maybe half of the department is quarantined because of this outbreak? How are you going to arrange the workforce for the next day?
Kita orang rasa a lot of policies are made without consulting us.
If you want to do a lockdown, you need to do a proper lockdown. And that everyone stays at home, and there is proper financial aid, no cash in the accounts, food in their homes, with testing and vaccination. Because the promise of this lockdown is trying to make the healthcare system in Klang Valley have a little breather. Tak rasa pun rehat ni. I cannot see a light at the end of the tunnel because the lockdown is not a proper lockdown.
Whatever lockdown that we are doing now, right, is not addressing the main root of the problem, the main source of the infections. The lockdown is only involving those sectors that is not causing the rise of the cases. The rise of the cases lies on the industries that is not being locked down.
It's like firefighters trying to put out a fire, and yet there are people just adding on to the flames who really don't care that the house is burning down.
Kita masih ingat lah, kerana semua orang ingat PRN Sabah tu balik tak kena kuarantin. Lepas tu PKP yang separuh masa longgar sana, longgar sini. Ahli-ahli parlimen yang langgar SOP macam-macam lagi. Semua tu kita ingat. So sampai bila?
I know my colleagues are still fighting hard, and I think what was frustrating even more is like they can't say anything, you know.
Right now, every time we want to try to expose it, they will tell everyone in mass media that situation is under control, when we are like, hello, we are drowning here. Instead of recruiting new doctors, we are recruiting new teachers. The schools are closed and we are recruiting new teachers.
If the government has no idea, then please look at New Zealand, Singapore, Taiwan. Try to get their strategy and try to implement it in Malaysia. If you know certain strategy works and you don't do it, memang kerajaan pembunuh.
Really, just something drastic needs to be done, or else we'll all just think this is not the time for politics. Just save the people, save the health system, save the country.
To be really frank, sometimes I just hope the policymakers, alright, just come down to the field, reduce the window dressing, be more transparent regarding the data they give to the people, reduce the red tapes that is required for us to get the necessary equipments. Nothing much I can say anyway, because I'm just a contract medical officer.
The fact that we are still on contract, that we could just be without a job once this pandemic is over, it's not a very positive thing to have on your mind when you go step into work and see this horrific scene before you every day.
We are really at war now. The foot soldiers in this war is mainly our contract medical officers. Diorang ni, because of that status, they are easily mobilized. But this is not fair to them. One of my MOs was given like almost 24-hour notice untuk actually transfer to another hospital to help with COVID work. Because their contracts, they cannot apply untuk specialty training. They are facing the possibility that his contract not renewed, despite these past 5 years working so hard and working very well in our care camp facility, which is not right. What I'm asking from rakyat, to just be the kindest as you are already are, and being kind means that you all will continue to help each other and make sure that no one is left out. What is not useful to us is another mural or another blue lights, but the things that would really help us right now, right? Everybody keep themselves safe, keep each other safe.
If you can avoid injury, you can avoid certain accidents. So make sure that you don't hurt yourself, because likelihood of you coming to get proper treatment will be low.
If you get your vaccination turn, please get vaccinated. Encourage other people to get vaccinated.